All right, Cindy, for this one I'm going to measure your ability to turn your palm up and to turn your palm down. Really important in this position that, again, you're keeping that elbow tucked in at your side, because if you come out here, it's not a true test of your motion. It's more substituting and using your shoulder and rotation to get the motion, and we want true forearm rotation to see what's going on there. So I want your elbow tucked in at your side, and I want you to do your best to turn your palm all the way up. Perfect. And then all the way over. Good. For this measurement here, we're going to start in a neutral position, so the best that you can. And we're going to go on the inside of Cindy's forearm, and we are going to go proximal to the most distal part of the radius and the ulna. Okay? So we don't want to be down here in the thenar area or the palm. We want to be on the inside. So we're going to start again with 0. Okay? 0 is our straight line. And then, Cindy, you're going to go ahead and turn your palm up. And then we're going to keep that perpendicular position, and we are going to rotate around to the flattest point that we can find on the forearm, and we're going to measure that range. If you've got someone who is a little bit, again, fleshier, has a more of a bulbous flexor tendon area, that can be a little tricky in measuring, then we just want to lay it as flat as we can lay it and take your measurement that way. So that should be reading about 90 degrees in a normal range. And now we're going to go just the opposite position. We're going to do a palm down. In a palm down position, again, we're going to go just proximal to that styloid, starting with a straight line here, and then measuring over, so we've got a flat goniometer across the top. And you want to just make sure you're squared up. And again, in normal range of motion, that should measure about 90 degrees. Okay? Thank you. We're going to go into wrist flexion and extension. And for this one, Cindy, it's going to be best if I have you scooch close to the table, and we'll have you maybe face that way there. Let's get you sitting. I'll make you nice and comfortable. And for this one, we'll measure your right side. For your patients, you want to always have them comfortable and the most, is this a good angle?
That's fine.
Is that okay? I find the most comfortable position is to have that arm supported rather than have them up in the air and doing it free floating around here. So if you've got a little proximal support, my hands are cold, I apologize. I'm going to pick you up like this, and what I want you to do, it might even be better to have you back here. I don't know if you're going to get a good angle from this.
That's fine. I can just move. Keep talking.
Okay, so from here, all I'm going to have you do is bring your wrist forward, and then I'll have you bring your wrist back. Let's try that again. Forward and back. Okay, so we're going to start out again with that straight line in the middle, so what we call a neutral position, and we're going to go over the dorsal aspect. I like to line my goniometer right up around the base of that third metacarpal. And if your client has a lot of bracelets, I might ask you to take those off. Could we do that?
Sure.
That will allow us to get a nice flat access around the forearm.
Really hard to get off.
And if you can't, we'll make do.
Maybe these big ones off. Maybe that one.
If we can go pretty flat against the forearm, that would be ideal. So we'll line you up here, and then I'm going to have you bring your wrist forward, the best that you can do. And again, looking at flat through here, and as flat as you can around here. Now those carpal bones want to pop up here, so you just got to do your best to work around that. And that measurement is right around 70 degrees for Cindy. All right, excellent. And then the opposite directions, you're going to bring that wrist back. And we're going to go right through that volar aspect, lining that goniometer up right here, and flat right through that carpal tunnel area there in the palm. And here you're measuring about 60 degrees.
And make a note, can you put that back on there for a second, Diana? Make a note of two things. First, on the swing arm here, if the person has smaller hands, you can easily thread it through one of their little finger spaces. And both for flexion and extension, you can't really get away from that little tented look. So don't cram the goniometer in trying to make that tight. Otherwise, you're going to push into skin, and it's not the most comfortable thing in the world.
Yep. And the other note that I want to make is that for some of your patients that may have scars, either volar or dorsal, it may be tender to lay a goniometer across that area. So you are able to do a lateral measurement as well, which would be just lining that goniometer up laterally with the access through the wrist joint. And let's come forward, Cindy. And then again, adjusting as you need to adjust through the thenar eminence, and then let's go back. And then again, adjusting that axis and getting it as lined up and central as possible. So that's an alternate position. That position, whether you do that position or the other position, is irrelevant as long as you're consistent in measuring for remeasuring purposes. And again, you want to measure the same way as your team members measure. So we'll go from here into radial and ulnar deviation of the wrist. So the four main positions of the wrist: flexion, extension, radial, and ulnar deviation. For this position, we're going to line the axis of the goniometer up again at the base of that third metacarpal.
And as you're feeling that on various people, there's a little bit of what I like to call a divot,
Yep.
kind of right at the base of it, so you'll just kind of feel a little bit of a depression there.
And again, this is one of those positions that may have to be adjusted as the hand moves, so keep that in mind. So the stable arm is going lined up against the forearm, and then the movable arm will be where you're swinging. So Cindy, from here, I'm going to have you move the hand towards the thumb side. Very good.
And notice as Diana moved that she maintains that swing arm on the third metacarpal, not on the whole third digit, because the third digit actually deviates further to that side than the metacarpal.
Exactly. There's a joint in there, so that's going to move a little bit. So we've got not quite 30 degrees there, around 25, 26 degrees, and now we're going to go the opposite way towards the little finger side. And again, you may have to realign this up. We want a neutral position here. And as far as you can go with that, here we go. And that's around 35 degrees for Cindy. And so there's some norms in your book about the ranges for this, and that's going to depend on the patient as well. Some of your bigger guys might have a little tighter joints and may not be as flexible as some of our young ladies are. So, okay?